please call upon the first panel speaker for this session. We have Dr. Nandita Palsetkar, founder Bloom. A huge round of applause for her, everyone. The next speaker for this session we have is Dr. Rishma Dilonpai, award-winning gynecologist. A huge round of applause for her, everyone. And now it's my honor to I'm really happy, and it's my honor to moderate this panel discussion amongst these eminent speakers and doctors that we have. So again, a huge round of applause for these wonderful ladies on stage, everyone. All right, so is everyone with me? Yes? I don't think so. We had lunch. You all had your lunch? It's post-lunch. So we'll definitely move on to other activities as well. I need their energy in this conference and in this session. Is everyone with me? Yes. Wonderful. Now, this is the energy that I want all through the day. We have to come back tomorrow as well for the day 2 as well, right? All right, so now before jumping on to the questions, I would like to set the context of this panel discussion that we have today, which is that focuses on the future of reproductive health and how technology innovations can improve the reproductive health. But before that, I would like to introduce our speakers over here. We have our speaker, Dr. Nandita Palsetkar. The story evolution of IVF in India cannot be said without the mention of Dr. Nandita. Our first panelist, a health tech pioneer, she's credited for establishing the spindle view technology for IVF so as to prevent damage to the genes during test tube baby procedure. A scientific director and founder of the famous Bloom IVF group, and among the 100 phenomenal entrepreneurs recognized as ladies lead by Hindustan Times. A huge round of applause for Dr. Nandita, everyone. Also, it's an honor to introduce our next panel that we have today. India's leading consultant, gynecologist, and infertility specialist attached to Lilavati Hospital, Jaslok Hospital, and Hinduja Healthcare Surgicals Hospital. She's the only Indian to have served as president of all 3 leading gynecological infertility and endoscopy organizations. The only Indian selected to be on the board of the International Federation of Fertility Societies. Please join me in welcoming Dr. Rishma Dilonpai. Everyone, a huge round of applause. Well, so before moving on to the questions and deep diving into the same, we all know that the importance of technology in today's generation is like way too much. And a good number of revolution and the tech digitalization has happened, especially the post-pandemic, which has also covered the field of the reproductive health. So why don't you all just set the context for me, starting with Dr. Nandita, that what is the importance of, first we'll cover the reproductive health and then we'll move on to technology. So according to you, what is the importance of reproductive health in a woman's life?
I think if you look at it, 1/3 of a woman's life is actually spent in the reproductive age group. And it's a very important part of her life because she's multitasking. She's doing a lot of things. She's getting married. She's having a family. Then her career is taking off. And today we are such super women. We want to achieve everything everywhere. So there's a lot of stress, a lot of mental stress which is there. And our reproductive system or reproductive health is actually a lot controlled by your brain. And so I think it's very important that we pay attention to these women, especially when they have all these multiple things going on in their life. We should be there to assist them, to help them, and to guide them regarding whatever problems they have, or just the normal things of life. These are normal. That's what should be done. I think it's a very, very important phase of life because, you're planning and doing a lot of things.
Absolutely correctly said. I think it's mainly about speaking, communication, and talking about it, which is the very basic and a very important thing. Yes, you'll agree with me? Dr. Rishma, if you can just add to it, how important is reproductive health?
The most important thing in a woman's life, and often the most neglected one, unfortunately. And I think it applies to almost everyone here, and you can look at yourself and see how much importance you give to your health care in a day-to-day practice in comparison with how much attention you pay to your husband's or children's, particularly health and well-being. How much attention you pay to the clothes you're wearing, to the makeup you're doing, how you're looking, and how much attention you pay to all the other aspects, which is your inner health. And I mean, every single day I can give you many, many examples. Like yesterday I had a patient whom, if you see her, like gorgeous looking, just hitting 50, well-versed, partying every day, you know, the woman of the world, typical Mumbai socialite. And she was seeing a gynecologist yesterday when she met me after some 17 years. Okay, she had never met a gynecologist. And when I said to her, what about your pap smears? What about your sonography? Like, no, doc, I've just been very negligent. But the amount of attention she pays to how she looks and how, you know, so it's really unfortunate that the world now is only about Facebook and Instagram, and that too, the superficial aspects of it. I'm sure if you delve into it, you'll find healthcare there, but nobody's looking there. So I think it's very important for us to really focus on what is important. And that's what this is all about,
absolutely right? Correct, because we always, especially when we talk about social media, it's only about showing the positive things. We never talk about what's going within and it's important to put that out as well. So I think we've definitely set the context of why we are here today and adding value to all the people over here. And we'll directly deep dive into some of the really important aspect that needs to be covered. So I'll start with Dr. Rishma. What do you think that how technology, like we spoke about how important reproductive health is, but now moving to technology, what do you think how technology has changed management of common diseases such as fibroids? What do you think about it?
It's a good point to start on, because this is an example of a problem which affects 20% of young women. Anything from the age of 20 to 50 typically is the age group which suffers from the problem of fibroids. Extremely common: fibroids, endometriosis, PCOD, polycystic ovaries. All of you have heard about these issues. Extremely common. And you know, people literally avoid going to the gynecologist even if they know they have fibroids, because they are bleeding, they have pain, sometimes they don't become pregnant because of fibroids, but they feel the moment they go to the doctor, he'll suggest a surgery. And people are petrified of the word operation. And so they avoid, and I've had patients coming to us with hemoglobin which is like 3 grams and 4 grams. They're bleeding away, but they will neglect because they're scared of the surgery which we will suggest. And so this is just to bring to your attention that with technology today, so much has changed that fibroids, which up until now had no other solution but surgery, now can be approached in a completely non-invasive fashion. We are doing now for many years in one of the South Bombay hospitals, we are practicing MR-guided focused ultrasound. So you literally have to just lie inside an MRI machine like you would for any other test, and it's like a laser beam, if you will, emanates from the base of the machine, and it actually goes directly into the fibroid and burns it. So you're literally lying for an hour or an hour and a half in the ultrasound machine, nicely sleeping, sedated, no anesthesia, no cuts, no stitches, and you come out after 1.5 hours from the machine and your fibroid has been ablated. Now, it's not disappearing overnight, but it's going to just shrink, 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 and disappear away. And I mean, so many women, for example, if you have a daughter who's 25, has a big fibroid, you don't even want minimally invasive surgery. Like all of us are doing keyhole surgery for many years, but even keyhole surgery will give you 4 small cuts on the abdomen. So there are 4 cuts which you need to explain to whomever your wife is getting married to. So it's very important that non-invasive techniques are there. There are many other non-invasive techniques. There's now a portable, it hasn't come to India yet, but it's very much prevalent in other parts of the world, and I'm sure it'll come to India very soon. A small handheld ultrasound machine, which can actually, you can go to any part of small town, village, whatever you will, carry that ultrasound machine. It's called focused ultrasound, so it focuses the beam and it generates heat. So you can actually go do this to a woman's abdomen in a small town, and you can actually burn her fibroids with the ultrasound-guided focused, energy. There's radio frequency. So there are a lot of things. There's medicines coming, which is completely non-invasive. So you don't have to worry. Everything is not ending in surgery. In fact, our field, gynecology, is moving more and more away from surgery into non-surgical interventions. This is just an example, a starting point. There's so many diseases, endometriosis, polycystic ovary, which we can discuss, where we are doing less and less intervention with better outcomes.
Great, thank you for that. I think it's a really very important point put that people were actually petrified before to even when people talk about surgeries and all, but now this industry moving more towards technology is definitely going to be very beneficial for women out there. Now talking about we spoke about fibroids, moving to infertility and IVF treatment. This question is for Ms. Nandita, that what about IVF treatment and infertility? How is technology helping patients seeking this treatment like for pregnancy?
I think the maximum benefit that technology has given is in the field of infertility. Really, over the last 30 years, I mean, when I began practice 30 years ago, actually the success rate was like 15%. And with the advances in technology, the advances in different fields that we, a lot of new techniques have come in. Today, I can confidently say it's like 50% to 60% in a girl who's under 35, who's got good number of eggs, husband is not that bad, in a good prognosis patient, And even in a bad prognosis patient, it's about 70% if you try multiple times. So that is where technology has reached. Before 1992, if the husband had a problem, you had to go for donor sperm. So ICSI was the first technology which was a major breakthrough. It's a test tube baby technology where we take the sperm and one egg and inject the sperm into the egg. So it's as simple as creating the baby outside the body. And then a lot of new things like, egg freezing. I think we are all here as women. We're talking about empowerment and how digital technology can help us. I think this is one technology which is empowering women. As I was talking about it earlier, women are supposed to be super women. They're supposed to study, they're supposed to do their careers, and they're supposed to get married and have children at the same time. So there is one way of freezing eggs, and this egg freezing technology became available only after 2006 because the technology of freezing improved so beautifully. Before 2006, the freezing technology, we lost nearly 60% of the embryos. But after 2006, the technology changed so well that 100% retrieval was possible. And then we could confidently offer, So young cancer patients we are doing, patients who have not, who are not getting married or who are postponing their childbirth or who have their careers, they've not had the time to find the right person. They're all freezing the eggs and getting children data. I mean, some of the celebrity patients you've heard of, Ekta Kapoor, Diana Hayden, they've come out and talked about
Absolutely.
it openly, so I can talk about it. But this is how technology, now latest that we have is, I think Rishma also can agree to it, that the artificial intelligence in IVF is phenomenal. Like the other day, I had a young girl who was about 30 years old. She had severe endometriosis, which you were talking about, and her ovarian reserve was very, very low. When I did her stimulation, I got just 2 eggs. Now, those 2 eggs, when I subjected them to artificial intelligence, I have got a report saying that there's only a chance of 10% pregnancy rate. So that has motivated her to go and do more cycles. Because what happens is, this is known as pooling. So there are a lot of patients who have very less reserve, they go for pooling. So artificial intelligence, big data has really, really helped us do all this. I think I can go on and on, but I'm going to stop here. But it's amazing how technology has come into the field of medicine, really. And Abdul Kalam is the one who said that. That technology is a boon to the field of medicine, actually. And it is very true.
Absolutely,
I'd like
yes.
to just add here, because
Sure.
it's a very vast area, and I know that you can't cover it in 1 minute, but just 1-2 important areas. She mentioned egg freezing, and that's extremely important. The other end point being older women, women whose eggs are literally finishing, or women who are 45, for example, and want to have have a baby, or those who are young and for some reason, endometriosis, for example, have damaged their ovary, we are now doing something called ovarian rejuvenation. So it's actually anti-aging. You can actually inject material into the egg, like stem cells or PRP, and there are various other techniques to actually activate the ovaries. So not only for pregnancy, to activate the ovaries in an older woman so they become rejuvenated and can produce eggs, but also the hormonal aspect of menopausal women. So if you can activate ovaries, they'll continue to produce hormone for a longer period of time, and women can stay not just beautiful because the hormones are there, but also health-wise, because after menopause, so many negative effects start. So that's one other important aspect. Fertility preservation, she mentioned it, but very important to highlight that if supposing a young lady is diagnosed with breast cancer and she has to undergo chemotherapy, she'll finish her ovaries. They'll be, she'll go into menopause. So if you can actually take her eggs out or, make embryos out of it, or take a piece of her ovary out and freeze it before she undergoes chemotherapy, we can preserve her fertility for the rest of her life, or when she gets well after chemotherapy, radiotherapy, we can actually give her a baby after that. So there's lots to be said for the magical technology, and not only in the field of IVF, but also for, like now, artificial intelligence is predicting which patient is going to have a premature delivery. They're predicting which patient will have a normal delivery or a cesarean section. Of course, it's not 100%, but it's a very good guideline, for us. So across the field of reproductive health, you have fantastic usage of technology.
That's the beauty of big data.
Very well said and very well put. I think technology is definitely changing the entire sphere, and the landscape is changing when it comes to IVF and, in times of pregnancy. But we always say that, yes, technology is definitely beneficial, it's good, but then there are times that there are loopholes or there are gaps also in it. So I'll start with Dr. Nandita. What do you have to say that when I say that there are gaps in women's reproductive health that technology innovators must look at? What do you feel?
I think the first thing that is there is advocacy. I think that's a huge gap because people, the technology is there, but people don't know how to use the technology. In fact, I was listening to somebody, on the YouTube while I was coming, one of my friend's daughter was talking about automobiles. And she says that, the cars today are intelligent cars. But the owner, after having bought it, doesn't even know about it because the salesperson hasn't communicated to that person. So I think this is the same thing that's happening. The technology is out here. How much can we talk about? So you need your digital platforms to actually first promote advocacy. I think it's very, very important to promote advocacy. That is one. And advocacy, if you promote, you're also going to become an aggregator. So what you need is also to, provide a way to give these patients directions where to go. I think these two are the primary things that are important. The other thing which I feel is really, really important is that, algorithms for diagnosis. I'm going stepwise, kind of. So next comes the diagnosis. So quick tests. Now today we have a test where you can put a drop of semen and your mobile smartphone. There's a technology which you can take a picture and your count, everything comes on it. So you can do a home test. Wonderful, kind of a thing. Yeah. So that kind of testing should be available where girls can predict in the house and they can, plan their sexual activity around it, because obviously people are too busy. Half the time the couples come to me, I tell them, you've come to me because you don't have time to do it. So they actually laugh and they say, yes, doc. So maybe if something like this comes up, it will help them. It will definitely help them. The other thing that I feel in our thing is to make it cost effective. We have technology which we're using. I'm using in the lab. I have this embryoscope, which is with artificial intelligence. It has this convoluted neural networks with artificial intelligence and, very fancy stuff. It costs a bomb. It's like the Rolls-Royce of IVF. Okay, we've got only 2 of them, but if they were indigenously made and if they were available, it would be available to everybody. Only 1% or 2% of our population can afford these kind of things. We need to make it available. So of course, people like us, we are making a difference that we give the same technology to the people who deserve it even if it's at a low cost, we don't compromise on it. I mean, we would absorb
Absolutely,
the
yes.
cost. So I think we need technology to come in and fill this gap where we can make it more cost effective. And the last thing that I really want to stress upon is that precision medicine. You know, I think precision medicine, I love precision medicine. Like, I'll just tell you a short story. I had a patient who years ago, she had 3-4 abortions. So we did surrogacy and she delivered. Now, surrogacy law has come and she cannot have another surrogate. You know, she has to carry her own child. She's young. So I did her precision medicine tests, and we've got such fantastic reports which tell me that these are the reasons why she cannot carry the baby, and these are the answers. Treat her with this. So she has a choice today. She has an option which was not available 8 years ago. So I think precision medicine has come in a big way. We need more evidence backup. And that is where digitalization, where you can come and step into the clinics, help us in data collection. We need people to help us with data collection and collaborate with doctors to create this information. I think digital guys need doctors on their board so that two of you all together can work out solutions. I think that's what is the future holds.
I think that is definitely a very important point put. Cost effectiveness and advocacy. I think very, very important points put out. Dr. Rishma, if you can just add something to it, what do you think? What are the gaps here and how can that be overcome?
Yeah. We were just talking before this that technology is everywhere and thousands of tech apps are coming up every day. Medical tech apps are coming up every day. And I've personally gone through this with many of the younger generation, many of my friends' children. They're all starting out their own apps. In fact, one of them is speaking tomorrow, whom I've helped and handheld in the beginning stages of her app. So somebody's starting something on PCOS, somebody's starting something on maternity care, somebody's something on child health and upbringing, somebody's starting something, a friend of my daughter from Yale called me the other day, she wants to start an app on urinary tract infection because it's so common, UTIs, and elsewhere in the world it's very difficult to access care. So it is just fragmented. To me, one of the most important things is information is there. Everybody has information. How authentic is that information? How simple is it to access? How do we integrate this information? 10,000 maternity pregnancy apps. Things to calculate your last menstrual period. So there's nothing integrated. So I think it all needs to kind of come together and make sense. Otherwise, you get lost in the web of the internet.
Absolutely,
and you don't know. And sometimes you're really getting stupid, wrong information. And which is why, there's such a thing amongst us doctors that we often talk about. We do not want those patients who come with their own diagnosis in their hand and their treatment also in the hand and tell us I've downloaded everything. And it's a fact, and there are all these little stickers which they put up, like the patients who've come with the Google diagnosis, they have to pay us extra money because we will not, we'll have to re-diagnose them and again retreat them because it's very difficult to convince patients to, a different line of therapy. So basically that, and there are a lot of people are focusing on niche areas. There's a lot, for example, our maternal mortality rate, right? That's a figure. Maternal mortality rate in the country has become fantastic. It's become 97 per 1 lakh births. But what is our SDG goal? In the next 7-8 years, we have to bring it down to 70. How do we do that? Nobody's talking about it. Yeah, the government is, to some extent. But what about all the tech companies? Look at the incidence of cancers, cervical cancer. It is, unfortunately, we are the leaders in the world, one of the leaders in the world in cervical cancer. Now, literally today, in the city of Mumbai, well-educated, highly, up on the social strata patients coming to me have never heard of the HPV vaccine, are not vaccinating their young girls. So what is this whole technology thing doing if you haven't been able to communicate to people? So cancer, cervical cancer, breast cancer reduction. I was just talking outside somewhere now, there's a machine, small little portable machine, which you can actually take anywhere. You can do the breast sonography and pick up an early cancer right there by your bedside. So that is technology, but nobody knows about it, nobody's using it. So, that kind of a thing. And the last thing is even about non-communicable diseases, diabetes. We all know how rampant diabetes in India. How are you reducing it? So there are things, there are fragmented technologies available. Polycystic ovarian syndrome, that is one of the causative factors of diabetes in women, you know that. A girl who has PCO today at the age of 15, at 30 will go ahead and get diabetes maybe. So you need to have technology for all of these things. So I think it's fragmentation which needs to be integrated. There needs to be, of course, content created. But the important thing about the content is it needs to be disseminated. It needs to be either pushed to the patient or the patient,
Absolutely,
or you need
yes.
to pull the patient towards you, right? One of the things has to be done. So there has to be dissemination of that information. And there has to be some kind of an evaluation, assessment. There's nothing. You just take, anybody sits down, makes an app, puts it out there. Who's assessing it? Who's evaluating it? Is it authentic? Is it graded? Is it recommended? Who is doing all this? There's nothing. So I think we need to kind of really bring everything together, the fragmentation, and that will make a huge difference.
Definitely, yes. I think one word that I can use here is awareness. People, like you said, people don't know about what technology really exists, and it's very important and one of the important aspects that needs to be covered. And I think I have one last question for both our speakers here. We'll start with Dr. Nandita, that it's the time of startups, especially post-pandemic. People have come up with a lot of startups, and when we talk about the healthcare section and the healthcare industry, first question is, where do you firstly see the future of women's health, and the biggest opportunity for technology startups and innovators can use a better ecosystem around women's healthcare?
I think, post-COVID, people have realized, forget women, people have realized that they need to pay attention to themselves. COVID has made everyone introspect, and they've made everyone realize that stop, go slow, take care of yourself, look around, look at the trees. So I think that has made a lot of difference. So yes, healthcare is going to be a top priority. In fact, even our country is, has doubled its spend, the health budget this now in the next 5 years. And they're spending a lot of money, and they believe in universal health care. And I think that is what is important, that what we talked about, creating awareness. I think the startups first need to be able to reach out with the correct information. That is the most important thing. The advocacy, the awareness that there are people who will treat you, and certain things should not be treated at home. That is very important.
Correct.
Because otherwise you're asking your neighbor, I have this problem, that problem, and she'll say, haldi ka doodh piyo, ye karo, wo karo. It all started during COVID. So many home remedies came up. And we don't know what is correct, what is wrong. But there are certain diseases which need the help of a professional, and that is what you need. And as far as startups are concerned, I think healthcare is just, not only it's sprinting into the future. The technology is just here to stay, and startups are doing very well in the health industry. And I believe differently, Rishma, that there are, on one subject, there are 100 people, because I feel the world is very vast. So I feel there is space for 100 people. But the only thing is, what she said was the content has to be accurate. Because, one person cannot reach the whole 1.4 billion in our country. So there will always be multiple, and that's the beauty of our country. I think we have so many intelligent people, and I think, the minute you own something, you start something, and you have people who are very intelligent working with you, they will leave you in 2 years and start their own, because they've learned how to do it. So I think that is the problem with Indians, but that's because we are very good at it. We are extremely ambitious, we're extremely hardworking. So the future is great of the startups, because there is a lot of scope in healthcare. Healthcare is a budding, sector right now. I don't like to call it a business. So I think it's a budding sector, and it will definitely have a lot of scope. And I already mentioned, I think, the gaps, and those are the ones which I think you should focus on, like precision medicine, how to deliver drugs, the safety of the drugs. Suddenly there was, the other day there was in the newspapers that there were deaths due to this very common injection that we use. And the reality was something else. It was not of the proper company. It was spurious. Now, very few people know about it, but the entire population gets scared. We also get scared to prescribe it. So I think drugs do have a side effect, and it ought to be given, and it was given at a big hospital. Imagine if it was at a small hospital. So we have to understand this and accept these things, and this awareness has to be spread. So, like say bots, when a patient comes and is taking some treatment, communicating with the patient, I think those are something which we doctors actually require. And there are a lot of things which explain how the procedures work and all. I think there's a lot of scope. And we are only, both of us are talking about reproductive health. I think the whole body is there. You can, and even the curriculum of the medicine is so good, because you can actually teach MBBS students, dissections and how the drugs work. Sky's the limit for you guys. Take me on your board.
Very well said. Dr. Rishma, if you can just add something to it, what do you think the future of women's health is?
I think a lot of things have been mentioned by Nandita. But, it is, one is information about diseases, for example. That's one thing. But even if you look at what does the patient want, for example, in a city like Mumbai, you have access to 1 million doctors. But just step away an hour or an hour and a half from Mumbai and you may not have that access. And so access is extremely important. If somebody can provide the link between that patient who doesn't have access and me sitting here, that would be a real bridging of the gap. So if somebody can go there, do a test on a patient, do a blood test. Now there's 1 drop of blood and you can do so many tests on the drop of blood. Convey that to me sitting here, because many of the doctors don't go to rural areas and practice. So if we can analyze that report and get back to that person. So telemedicine is something which is very, very important and hasn't been mentioned so far. And all of us have learned it. The government has approved it during COVID. So now we can do teleconsultation, give, prescribe medication. So telemedicine is huge. Not only that, portable healthcare, like one of my family members practices in a rural area of the US, and since they don't have access to everything, a CT scanner and an MRI comes once a week on a van and provides, that technology to them. And then the reports are obviously sent to the doctors sitting in a big city, and they analyze. So radiology, reading X-rays, reading CT scans, reading blood reports, this is all technology and how it is transferred. So that is really, really important, bridging that gap. Also, help the doctors. All doctors are looking for patients, right? So we have so many, startups which are catering to that, right? We are giving you consultation, we're giving you patients, but it's all, again, like I said, fragmented, not very authentic, not very good. They don't screen the patients. I've had a personally very bad experience with some patient calling up with some really vulgar, material, but coming through a proper app, which, consulted and paid the money, and then that person calls me, and it was like, very traumatic for me. So those kind of things need to be, the technology has to be improved. If you're connecting a patient with a doctor, then make sure you have your systems in place that these kind of things don't happen. So, a lot of things are there, creating patients for the doctors, creating doctors for the patients, bridging the gaps. So many, many things are there. And like I said, our federation, Gynec Federation of India, Dr. Rishikesh Pai is the president currently. And his actually slogan, if you will, is called Badlav, or change. And it really involves 3 segments, which is integration, which I spoke about, integrating various things and giving a strong platform in which you present that healthcare solutions. Equality, extremely important. Unfortunately, a small segment of population gets extremely good healthcare and the rest don't, and that I think is completely unfair. Healthcare needs to be given to all. That is SDG goal number 3, health for all, so that has to be provided. And the third segment of that badlao is using technology to achieve this. So using integration, equality, and technology, that is what will really achieve the badlao or the change that all of us are looking for.
Absolutely, very well said. I think some of the very important points that we can sum up from this entire discussion is like, though technology is very, very important and it's going to take our healthcare sector to new levels, and it has, it has taken to a new level altogether. But there is a lot more work to be done. But I think if the gaps are bridged correctly, it is going to create wonders for sure. So now we'll move to our audience. Any questions if you have for our speakers? I think we have here.
Lovely session, doctors. I think it was the first time that I heard in one breath talking about medicine and technology. So, Dr. Nandita, when you said, whatever we're talking about IVF, and then spoke about big data, my dad being a gynecologist and me being an engineer, we never had those conversations. So it's definitely revolutionary. It's a revolution. Dr. Reshma, what I wanted to ask was, we spoke a lot about democratizing women's health, and we built a company that's trying to do that. But tiny startups like ours can probably touch 100,000 lives. We spoke about doing this in a nationwide sort of a scale. I'd love to know and hear your thoughts, both of yours, on how you think that equality, technology, and that space between diagnosing something and actually disseminating to the 1.4 billion people and so many women in the country can be made possible by all of you and by femtech companies like ours. How can we do that while we are trying to keep our heads out of the ocean?
Yeah. I think you've already made a beginning with this meeting, for example. At least the concept is there. Like you said, you never discussed, engineer and doctor never spoke to each other. But now that really has changed. And believe me when I say at least 5 to 7 startups will be meeting me in a month in my clinic. Most of them are young startup founders. There's somebody called
Wonderful.
Doc Mode, Doc Talk, various little things. And they're coming out with a whole lot of things. And many of them are young children whom I know who are starting out. And of course, like I said, unfortunately, it's fragmented. Some of them grow. Some of them just crash out of the scene after a few years because it's not viable. So it is hard. But, I feel that there is space for so much. And meetings such as these, recently, I think about 4 or 5 months ago, I was in Israel attending a Femtech, huge conference. And it was an eye-opener, the stalls with all these young people, with so many apps, starting with breastfeeding. There were so many breastfeeding-related apps. It was amazing. So, there's so much happening. So it's a developing scenario. It's not going to happen overnight. But this is going to be an important field, Femtech or Tech Med or whatever you want to call it. And it's going to develop. So the strong startups are going to, rise up and become the Facebooks and the Twitters of the industry. And then there will be some which are really not that strong, which will die a natural death, and that's fine. Yeah.
Personally, I think I agree with her. And also what I feel is, I was the president of the All India Association of Foxy. What I realized was that I had the drive. Like, you're a startup, we were small, okay? I wanted to do cancer prevention for this. I wanted to do menstrual health. I wanted to do anemia hatao, all kinds of things. And with some projects, we were able to touch 100 women. Anemia, we were able to touch 200,000 women. With cancer prevention, we were able to touch 100,000 women. But we couldn't go beyond that number. 200,000 was with the help of a pharma company. They really went out and helped me out. So we touched about 1,000 doctors and we were able to do that. The 100,000 was with Brahma Kumari. So, you need to think of such kind of organizations with which you can partner. So you become a partner with these kind of organizations and you can reach out to people better. Like our Foxy organization, we are 40,000 strong. I remember that we launched the app, we helped in the launching a couple of apps during my year. But also the other thing that I realized is the best. I mean, if you really want to hit the mark, nothing like the government can create a Titanic wave. If the government machinery works with you, so if you have the influence, if you have the connect, and you can get the government to take your app, you're sorted. You're totally sorted. Because the might that they have, the reach that they have, the money that they have to reach out is amazing. So I think, everybody is on the similar kind of a platter. It's just that the opportunity knocks and you have to grasp it. So I feel that these organizations, there are many organizations around you which will help you. And you should go and, you know what, some people will say no. 10 people will say no, but the 11th might say yes. Don't give up. Don't give up. What I always tell myself is, I'll go and ask. I know the answer is no anyway without asking. So I might as well ask. If it turns out to be yes, it's in my favor. If it's a no anyway. So have that kind of an attitude when you are creating it, and maybe you'll hit a pot of gold.
Yeah, just as an extension to that, our Organic Federation, which we're speaking about, along with some very large NGOs, has started a program called Manyata, okay, which is really trying to upgrade nursing homes. Now, if you've stepped out into some of the smaller cities of India, you will see the nursing homes are in pathetic condition. It's called a nursing home, but it has not even the basic facilities. So what we're trying to do is just provide basic standards of care in these nursing homes. Very difficult job to do, pan-India, Jharkhand, Uttarakhand, and UP, not easy at all. And during COVID, then of course, everything shut down, but we didn't want to shut down the program. So we started the digital, online training, assessment, evaluation. All of that went online, and during COVID, we could do about 1,800 nursing homes across India. We could actually give them the certificate of, Manyata. So, and then in certain states, we've tied up with the government, and just like she mentioned, wherever the government has tied up with us, yeah, so then the numbers are much more. The government is enthusiastic. Yes, you're, improving nursing homes conditions. So do that. So there are various ways you have to go about it. Government, NGOs, pharma, other technology companies, organizations such as ours, gynec organizations, pediatric organizations, depending on what you're working with. And I think together everyone can grow. But the important thing is, which some of the companies don't do, and I've underlined this, is share the profit, share the benefits which come out from it. It's not like if supposing somebody asks me for advice, I'm happy to give it, but I'll give it once, twice, 5 times, 10 times. By the 11th time, I'm like, what am I doing with my life? I'm sitting 4 hours with these people. You can't do that all the time. So you should also be happy to give away a piece of the pie, bring them on board, share the platform with them, so everybody benefits. That not many people are doing, and that is, everybody wants to take away but not give. And that, I think, also something which is holding you back a little bit.
Absolutely correct. Do we have any more questions? Yes. Yes, so you can take it.
Hi. So great session. Now, thinking from the parts of the... Here.
Hi.
Now, thinking of... so I'm father of 3, and I've gone through this this process and trying to figure out how technology helps, because we've had one child in a village where the resources weren't the great, and 2 of them were over here with Holy Spirit Hospital. So my question on the fragmentation of, information that comes out of all these different spaces is, do you all have a plan where, maybe startups can reach out to, say, a gynec association that has an accreditation process, whereas then this information that you get from the apps, or even these apps that, like my wife uses, for her periods, or when it comes to the baby's process, she uses a lot of apps. There's a lot of data that's input into that could probably benefit you all, that could be shared. So startups can maybe tap into an organization that accredits them, so users know that it's valid. At the same time, the data that these startups collect is very valuable, I'm sure, to the organizations in research, and also pushes future innovations that can come out. So is there a process that you all are looking at to maybe have like a Google Fit Works, where you can tap in all the, your steps and everything, and other startups in wellness use Google Fit rather than collect from each watch company, right? So do you all have something like that where you all can accumulate all the data from different startups as well as accredit them, maybe helping?
No, we don't have something like that, but we did start an app, which we actually, it was called Narika. It's still there. A lot of us gynacs spoke on it, and we created this app so that each patient could access it. And the idea was to build it up into this kind of a thing. You know what you're talking about. And it's on the slow burner. What happens is, it comes with a bang, and then suddenly, the whole steam goes off. So it goes slowly, slowly, slowly. So it is there, and that was the idea that was put forward to me, actually, that we'll get the patients on it. So each doctor has his own Narika app, So supposing, somebody comes to her clinic, it'll be Dr. Rishma Pai's Narika app. She'll be the doctor. So each one puts their data on it, and then all the doctors are talking, plus we had animated versions of it. But as you say, unless we advocate it, unless people know about it, unless the doctors are really motivated. So I think right now, about 10% or 20% may be digitally savvy. The rest of them still have to catch up. Okay, so that is where we are fighting a losing battle. And the Instagram and the WhatsApps occupy so much time that, people are using those for their, work, for their business promotions, etc. So I think this concept of app hasn't really picked up, and maybe you guys need to really put forward the positives, what we'll gain from it forward, and then we can work together and create such an app. I think Rishma, let's get on and really seriously, seriously start something like this, because data is going to be the big thing of the future. Data is going to make you really something that's very, very important. Because of artificial intelligence, the data is just being put together. So if we can get an app which has all the data which can be shared, how do you think Google and Facebook have become big? Because of the data which they have. So I think we really need to think about that and, work together. And as she says, share a piece of the pie. Make everybody a stakeholder. That's what's important.
Now, unfortunately, in India, there is no transparency. So coming to the field of IVF, for example, she mentioned some numbers. For example, in the best of centers which we run, our IVF success rate may be 60%, okay? But there are the center next door, which is a small little thing, started yesterday, 100% guaranteed baby. Okay, how do you compete with that? So unless there is transparency in data, it's all out there, and then you can, really have authentic information, authentic. A patient can see the data, like they have in Europe. The entire use Google, you will get each clinic's success rate as computed by the authorities. So you decide, okay, this one has 40%, this one has 50%, this is this cost, this is that cost, and you choose. Here you can't choose because everyone's saying 100% here, my result. So it's very, very hard. So I think we have a long way to go before we become, to the level of some of the well-developed countries, if you will. But and it becomes like his question about an organization, such as the Gynec Organization of India, for example, approving startups and, putting the stamp of approval is very, very hard, because where is the integration? You're sitting in your house making something, I approve it, tomorrow you do some fraud or do something wrong. How does an authority such as ours stamp it? So it's very, very difficult to do that, right? It's a profit-making organization. How do we do that? So if it's non-profit, if it's for public welfare, sure, we can look into it, but which are personal businesses, you cannot have an organization endorsing those. That's not a possibility.
No. It's personal investment.
Yeah.
All right, thank you. Do we have, we have one more question. We can take one more question here.
Thank you. First of all, thank you, both of you, for this wonderful, informative session. I'm Suchismita, representing Women's Health and Femtech from Frost & Sullivan. So I was recently working into one of the global IVF studies for my organization, as there was a client need. So talking about the technology aspect, as you rightly pointed out, AI and big data is transforming the space. If we consider the scenario in the developed countries, for example, in US or Europe, you have this pre-implantation genetic testing. So can you please help me understand how is this rate of adoption? Because it is something that is requested by the couples who wants to know which eggs are of superior quality that can give you better outcomes. So how is the adoption rate of this particular, currently trending technology in India?
Unfortunately, the law which has come in India, we are ruled by the law now, has not permitted this technology for anybody except those people who have a heritable disease. So anybody and everybody off the street cannot ask it. It's actually indicated in, people who have failed IVF multiple times, people of older age group, because, what's important is time to pregnancy. And every time you put back an embryo and she gets a failure, it's very traumatic. So in older people, if we can actually get an embryo and assess it, that if it's normal, PGT means testing of the embryo, saying that it is absolutely normal chromosomally. It's a normal baby, no downs, in simple language, no downs or no other problems, no mental retardation, etc. So this is PGD. And there are many ways. So they have completely stopped us from doing aneuploidy at the moment. But PGT-M, which is an inherited disease, is PGD, is permitted. And in America, there is PGT-P, which tells you the intelligence score. There's one company which tells you the intelligence score of which embryo is more intelligent and which is less. So, come on, and we can't do it. You want to add something?
Yeah.
The non-invasive.
No. In fact, many parts of the world, it's like the routine. Every single IVF cycle, every single embryo that is created is analyzed, genetic testing is done, and only the normal embryos are selected and said, okay, now you put back one at a time because they're normal and they're likely to give you a healthy pregnancy. Like I said, we have restrictions because we have the genetic analysis can also be used for sex determination, and that's a big no in our country. And so we cannot use this technology freely except for really cases who, have recurrent miscarriages or have a baby who's abnormal in the first place. So select cases only. But we do also now have, and you're talking about something which is quite invasive. Imagine a tiny little embryo. You make a laser cut on it, you take out a piece and you analyze it. We now have non-invasive genetic screening. So when the embryo is growing in a little dish, you actually just pick up the water around, the liquid around the dish, just pick that up and you can analyze it. This is artificial intelligence for you and genetic screening, non-invasive genetics. We are doing that. We have that access. We're one of the few IVF centers in the country which giving you non-invasive chromosome testing. So we have a lot of technology. But like I said, where is the information? How many people know about it? Only the people who come to us for IVF will know about it, not the others. So it's very, very hard to create that awareness, create the thing. Technology we are happy to bring, and we're always the first ones to bring the latest technology to the country. But not easy to then, sort of have everyone accessing it and using it. And then there are limitations within the system also. So, yeah.
Thank you so much, ma'am.
Thank you. So I think we can probably just take the last question since we're running short on time.
There's a gentleman there who's been
Who's
wanting
there?
to ask. Yeah.
Okay, can we pass the mic there? Ladies, we'll definitely take your questions separately.
Stand up right from the first minute.
First of all, thank you all the panel. You have given us a lot of information about telemedicine, egg freezing, and startups in all this healthcare industry. My one more question, which is important, is that I wanted to know about the umbilical cord freezing preservation method. So many people or many doctors recommend that if you preserve the umbilical cord, it will help you to cure disease of a baby in future, like a heart attack and many more non-curable diseases. So just I'm requesting the panel.
Yes, very important because there are now many cord blood companies which have come up, which as soon as the baby is born, they take the blood from the umbilical cord and placenta and they can freeze it forever after that. Now they also freeze the umbilical cord itself as well as the placenta because it's a rich source of stem cells. And we haven't really discussed stem cells, but stem cells, as you know, is probably the future of medicine. Already there are some applications which are approved. For example, childhood blood cancers. Childhood blood cancers or leukemias are fairly common. And these stem cells of the same baby which you have preserved at birth can be used for that baby for blood cancers. And that is an accepted treatment. There are many other treatments which are not that well accepted, which are still experimental today. But tomorrow they will become the future. So the thing is, it's all about, now it's a well-known thing, cord blood banking, yet half the patients who come to us do not know about it. We inform everybody about it. Then comes the cost factor, because there's a cost factor involved. So is it worth it? Should we do it? Is it this thing, so much money? So, this is what it is. There's an economic constraint on a lot of things. So I tell them very simply, there are definitely lots of uses for stem cells in the future. It may become a solution for all problems in the future. Right now, just few indications are there. If you can afford it, please do it. We don't know. You're preserving a vital stem cell source, maybe. And now they're creating stem cells from everything. They're creating stem cells from skin, from everything. But that's in the future. So if you can afford it, do it. If you can't afford it, don't stress over it. It's as simple as that.
I think just one word before you end up. It's what she's talking about is regenerative medicine. You know, that is the in thing now, rejuvenation. People are taking stem cells even to look young, anti-aging and all that. So there are so many things that are happening. Now, you know something, in our field, we are creating ovaries, artificial ovaries. So if your ovary is finish and you have those stem cells, we're using technology, a 3D print of the ovary is created with a cellular decellularized matrix, and we seed it with eggs and culture it for 2 weeks, and then it is put inside the woman. Can you believe it? I mean, it's done in mice, and that research is, I think, about 5 years away from being carried out in humans. So that's where medicine and technology is right now. So I think apps should come by the dozens.
Sustainability. Sustainable goals is also important, yeah. I can talk with some authority. My daughter is a computer science engineer, runs her own company, has her own technology startup. Not easy, it's very, very difficult. But yeah, it's very fulfilling when you do something which is your own and you see it grow and you see it flourish. It's fabulous. So all the very best to all of you who are starting out. You have a very, very bright future ahead of you.
Thank you so much, Dr. Rishma and Dr. Nandita, for devoting your precious time to this conference and this panel discussion. A huge round of applause, ladies and gentlemen. I think to times that people were petrified and were hesitant to talking about reproductive health, to today's time when we are sitting on one platform and talking about it, along with technology, we have definitely come a long way. So again, a huge round of applause, everyone. For all of us, definitely. Thank you so much. Thank you.